again is Abdominal from 1BSN 3, Pamantasan ng Luzon, Marikina. So for today's video, I'll do a abdominal examination for my patient. But the first thing we will need to remember is always perform hand hygiene. And I already wash my hands using bar soap, and I already wear my gloves in order to avoid cross-contamination and as a barrier for any kind of microorganisms. So let's start. So good day, Ma'am Myra Kabusaw. I'm Salvi Namira, your student nurse for today, and we will do your abdominal exam. So are you ready? Okay. So before we start, I'm gonna ask you some necessary questions regarding to your personal information and your health. So, your name is Myra Kabusaw. So, I'm gonna ask you some questions. First is, do you smoke? So, do you not use any kind of cigarette? Okay, so do you drink alcohol?
Sometimes when there's a celebration.
Okay, so do you what kind of diet do you have? Do you have a normal diet every day? Okay, so do you eat properly? That you don't skip meals? Okay, great. So I'm gonna ask you your previous history. So do you have any abdominal surgery or problems on your abdominal, such as surgery? Okay, so you don't seek any medical care regarding to your abdominal problems? Okay, so do you experience appendicitis? Okay, so great. So do you feel sometimes pain on your abdominal and you use some medication? Okay, so I'm gonna ask you about your past history. Okay, so I'm done. And your family history, do you have a relative that have experienced any liver cancer? Okay. So you have no family members that experience any problems on your abdominal. So next is I'm gonna ask you your lifestyle, such as do you exercise every day or how many times in a week?
3 times
Okay, 3 times
a week.
Okay, so do you drink any medication regarding to? Okay, so do you drink any vitamins? Okay, okay, great. So thank you for your personal information. So we will going to start to our assessment. First is we need to position on your proper position using your one pillow and do the proper position, which is lifting up the shirt, and your hand will go into position as supine or supine. Next is I'm gonna observe the size. Okay, since it seems that there is no problem on her abdominal size. The masses and the symmetry is also normal, and the breath flow, which is the movement of her respiratory, is also fine. She has a good normal breath flow, and her umbilicus is inverted to the midline, which is also normal. Okay, so I've done inspecting or observing her abdominal. So now next one, I'm going to use this stethoscope to auscultate your 4 quadrants and observe the vowel sound. I'm gonna auscultate the first upper right quadrant and the left upper quadrant. Next is the left lower quadrant. Next is the right lower quadrant. Okay, so it's normal and there's no problem. So I'm done auscultate the 4 quadrants. Now I'm going to use again this stethoscope to observe the vowel sound on her renal, aorta, iliac, and femoral. So we're going to use the stethoscope and for the both diaphragm and the bell. So first we're going to auscultate the aorta, which is above the umbilicus, and turn it to the bell to observe the small sound. So next is the renal arteries. The left renal arteries, and I'm going to use the bell. Next is the other side of renal arteries. Okay, so we will go into down to the iliac arteries, or the left iliac artery. And using the diaphragm and the bell. Next is the other side. Okay, so next we will going to go down to the femoral, which is above the our client hip bone. So we're going to use the diaphragm and the bell. Next to the other side of femoral and the bell. So the sounds is normal and I didn't find any problems on her vowel sound. So next is we're going to percuss our client abdominal. Next, I'm gonna start to the upper right quadrant using my non-dominant hand, and I'm gonna tap it using my dominant hand and my middle finger. Okay, so I'm gonna start to the right side, and I'm gonna observe the tympanic and the sound. So I'm gonna use this marker to mark the sound I will going to found in this abdominal. So from the lower, we're going to percuss it to the onto the upper part of abdominal. So we're going to start. Great. So mom, will you please take a deep breath, and I'm gonna percuss the upper. Okay, so we're going to percuss the other side, which is the upper side, to upper to lower. Okay, so the dull sound is located on this part, Okay, so we're going to do it on the other side, which is the same procedure we did in this right side. So I'm gonna percuss it. Okay, so mom, will you please take a deep breath, and I'm gonna percuss from upper to lower. Okay, so I'm gonna mark the part of dullness, which is and indicate that the air inside and fluid inside. Okay, so I'm done percussing our client abdominal and her 10th rib, which is I'm gonna mark the dull sounds on her on that indicates the air that has air inside. And now I'm gonna palpate the 4 quadrants using my palmar hands, and I'm gonna do this light palpation in order to let our client muscles to relax and observe if there's any lumps or problems on her abdominal. So I'm gonna palpate it now on the right upper quadrants, next left upper quadrants, next is left lower quadrants, and right lower quadrant. So do you feel any pain?
No.
Okay. So now I'm gonna do the deep palpation on her upper right quadrants, and gonna press it underneath her ribs. Okay, so I'm gonna palpate it and just inhale. Okay, so do you feel any pain?
No.
Okay, so I'm gonna do this on the left upper quadrant. Okay, so next is the lower left quadrant and lower right quadrant. Okay, so do you feel any pain, ma'am, or tenderness? Okay,
No.
so if our client feel any pain while you're doing the deep palpation, it indicates that there has a inflammation on her gallbladder. So since my client has doesn't feel any pain while I'm doing the deep palpation, so she has no problem on her gallbladder. So now I'm gonna do the hooking up technique on her ribs. So I'm gonna start to the upper right. So I'm gonna press it down and hooking up the ribs. So to feel the liver boundaries, the lungs and liver boundaries. So mom, will you please take a deep breath, and I'm gonna hook it. Okay, so I feel the liver using my finger. Okay, so we're gonna do this to the other side, to the left side, left upper quadrant. So I'm gonna hook it. Okay, so do you feel any pain while I'm doing this? Okay, great. Okay, great. So now I'm done palpating her abdominal. So now we're going to do the test for her appendix. So we're gonna start to the ISIS, which is the anterior superior iliac spine, which is between to the umbilical and the hip, which is the ASIS is between to the umbilicals and hip bone, and we're gonna do to press it and just so do you feel any pain? Okay, so now I'm done palpating our client abdominal. Now we're going to test her appendix. So we're going to do the appendix test. So we start to the ASIS test, which is the anterior superior iliac spine, which is located on this between the umbilicus and the hip bone. That indicates the location of our client gallbladder. So I'm going to press it, the gallbladder. And mom, do you feel any pain while I'm doing this? Okay. So if our client feel any pain or tenderness while you pressing the gallbladder, which is the SIS test, it indicate any symptoms about appendix or our client shows any symptoms of appendix. Okay, so now we're going to do the rebound test. That we were going to do that. Press the deeply part of our client's stomach and press it and let it go. So okay, so I'm going to do this to the right. Okay. So it seems that it is bounced back and it is normal. So I'm done doing the rebound sign test, which is if our client tells that she or he feels any pain or tenderness while we do the rebound test, is indicate any appendix or inflammation in her gallbladder. So it seems that it has a normal signs and the client abdominal is bounced back while we do the rebound sign test. So now we're going to do the iliopsoas test, which is I'm going to press our client leg and bring it up. And okay, so I'm going to do this to the other side. Okay, so mom, do you feel any pain in this part, which is your femoral and your located on your gallbladder? Okay, so you didn't feel any pain. So we're going to do the obturator test, which is I'm going to do the flexion of her knee and move it to like to up. Okay, so I'm going to do this to the other side. Okay, so do you feel any pain in this part?
No.
Okay, so if our client feel any pain while we do the obturator and the iliopsoas test, it seems also that our client has experienced symptoms of appendix on this side. And the last thing is I'm going to do the rotation of her knee. Inside rotation and outside. Okay. So next the other side. Okay, so inside rotation and outside. Okay, so do you feel any pain again?
No.
Okay, so it seems that on our palpation test and appendix test, which is the ASIS, rebound test, iliopsoas and obturator, our client didn't feel any pain while we're doing this activity. So it seems that there's no signs or symptoms of appendix. So I'm gonna pull it down the shirt. So we've done, and I'm already closed the door and closed the curtain in order to provide our client privacy and safety. So mom, just wait me. I'm gonna wash my hands and remove my gloves, discharge it, so avoid any kind of microorganism. I'm gonna wash my hands, just wait me, and I'm gonna put your record. past history about problems in abdominal, and you don't have any relatives that has history also to your cancer or any kind of abdominal problem,